Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. You know, while COVID-19 vaccine boosters and mRNA vaccines may be dominating the headlines, there are many other viruses that can also cause some pretty serious harm, but don't yet have any vaccines. One of them is a common virus called CMV, or Cytomegalovirus. It can actually cause birth defects if passed from mother to unborn child. We're here to talk about the efforts to find a vaccine. Our Dr. Panther, Vice President of Clinical Development and Infectious Diseases at Moderna, and CMV parent advocate Shayne Gaffney. Welcome to Health Professional Radio, both Dr. Panther and Shayne. Thank you.
Thank you.
Thank you.
Well, Doctor, if you would give us a bit of your professional background, and then Shayne, if you would tell us a little bit about yourself as well after Dr. Panther.
Yes, I am an adult infectious disease specialist, so I have certification in medicine as well as infectious disease. I've been working at Moderna for the last 5 years in clinical development, which is development of vaccines to test them for efficacy.
Okay, great.
And hi, I'm Shayne Gaffney. Medically, I have a master's degree in physical therapy, and I was a physical therapist for about 10 years. But obviously, today I'm here to talk about my daughter, Grace, who was born severely affected by CMV.
Well, Doctor, what is CMV, and how have the development of COVID-19 vaccines brought more awareness about some other diseases?
Well, certainly. CMV, as you have correctly pronounced, is cytomegalovirus. It's a common virus in most communities, most populations around the country and around the world. It's a complicated virus in that if an adult gets a CMV infection, that healthy adult hardly ever has symptoms, doesn't really notice it. And that actually includes, as you have pointed out, pregnant women. If a pregnant woman gets a CMV infection, often goes unnoticed, but certainly that mom has the chance of passing it on to her infant, and that infant could be born with congenital CMV infection, which is an unrecognized health burden around the world. It's as you had mentioned, the most common infectious cause of congenital birth defects. It also is the most common non-genetic cause of childhood deafness and childhood hearing loss. And so it affects the health of our kids in a tremendous way that is often not recognized. And so, though none of us would have wished for it, this pandemic has really been an example of how communities and how countries can learn about a disease that they've never heard of, teach themselves about it, take measures to prevent it, and hopefully that can be an example to populations who are at risk for other illnesses for which there's no prevention, including CMV.
Shayne, I heard you mention your daughter. You've got 2 kids, correct?
I do, yep. Grace and Finn, yeah.
Had you heard of anything like this before your daughter was diagnosed?
No, my wife and I never heard of CMV before. And, we kind of fit that unfortunate statistic where 91% of women don't know about CMV. Mm-hmm.
So were you told by physicians? Were there symptoms after you took your baby home?
Sure. So we were fortunate to be in a Boston Children's Hospital affiliated birthing hospital, which is Winchester Hospital in Winchester, Massachusetts. And the midwife there was educated on CMV. Mm-hmm. She knew the signs and symptoms such as jaundice, a blueberry rash, which they call petechiae. I don't know if I'm saying that right. Dr. Panther can correct me. She's smarter than I am. And, when we had her urine tested at day 1 of birth for CMV. That came back positive, and then we had a confirmatory PCR test on day 3, which also came back positive. So we really didn't hear anything about CMV. Your daughter is doing great in the womb, no problem, developing totally healthily, totally naturally. At least that's what we were told.
Yeah.
And we found out day 3 of life in the NICU in the hospital that actually your daughter is going to be severely affected by CMV. She's not going to walk. She's not going to talk. She's not going to be able to eat on her own. all those things that a parent never wants to hear, we heard those all that first 2 weeks of my daughter's life.
Wow. So, doctor, with that being said, I mean, horrifying. You're told that everything is okay all the way through your pregnancy. And then, as Shayne is saying, day 1, 2, and 3, you get all of these devastating diagnoses. What's the most important thing that you want people to know about this virus?
Well, the most important thing I want people to know about the virus is that, as I had said before, it's a very common virus in the community. And also what I want people to know is that not a lot of people know about CMV and about the potential devastating effects it can have on kids, the health of kids, and families as well. And I think that to be able to engage in an effort to learn about it and to talk to their friends about it and to teach themselves more about it and just to increase awareness would be a tremendous first step in addressing this virus.
Shayne, surgeries, medical appointments, all the therapies, things of that nature. What are you doing other than, being on shows such as this to bring more awareness to CMV from a parent advocate standpoint? Yeah,
really the thing that we're doing is working with great people such as Dr. Panther and also being partners with Moderna. That's a really, really important and honestly a blessing for me to be able to get the word out and educate people around CMV. Like I said, the impacts for my daughter were pretty significant. And you mentioned surgeries. She said 3 surgeries, and she's only 2.5. So she had a G-tube placed, eye surgery to correct esotropia, and then she also had bilateral cochlear implants placed because, as Dr. Panther mentioned, these kids most times are born pretty profoundly deaf or have progressive hearing loss. And in Grace's case, she was born profoundly deaf, so we had to correct her hearing through cochlear implants.
Doctor, talk a bit about the current research efforts at Moderna concerning CMV.
Sure. So currently there is no vaccine available against CMV, although vaccine research has been happening to find a vaccine against this virus for over 2 decades. And my team, we are proud to say have started a phase 3 trial, which is a large trial of up to 8,000 participants, to test an mRNA-based vaccine against CMV in a population of women 16 to 40 years old, which essentially covers the childbearing years.
I'm sure things are going to get more promising in the future. This research has been going on for a couple of decades. I'm hoping that a breakthrough is just around the corner, as I'm sure all of you as well.
Definitely. And I'd like to say one thing. Have your audience please visit nowiknowcmv.com and join us. Help us in our fight to raise awareness for CMV and get the word out. And
it's spelled just like it sounds. Nowiknowcmv.com. All one word, correct? Great.
Exactly.
Well, Dr. Panther, Shayne, I appreciate both of you joining us here on Health Professional Radio this morning. It's been a pleasure speaking with you. Thank you so much.
You as well.
Thank you very much.
Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Lori Panther and Shayne Gaffney. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.